Hello class. One of my goals since my youngest son's diagnosis of type 1 diabetes back in 2008 was to begin raising awareness of the disease. So I'd like to give you all a brief overview today of what the disease entails, what it takes to manage the disease on a daily basis, and some of the complications that can occur. So I'd like to start just by clarifying the difference between type 1 and type 2. Type 1 is actually an autoimmune disease. So an autoimmune disease is when your immune system attacks healthy tissues in your own body. So some examples would be lupus, thyroid disease, or rheumatoid arthritis. So in type 1 diabetes, the immune system actually attacks the insulin-producing beta cells in the pancreas. So this destroys the cells, so insulin is no longer produced at all. So the person will become insulin dependent at this point. So insulin is the hormone that is actually produced in the pancreas, and insulin is used to convert carbohydrates that are ingested and convert them into energy for your body to use. The cause of type 1 diabetes is still being researched, although hereditary and environmental factors do play a role. So with type 2 diabetes, insulin is still being produced by the pancreas, although the body is not able to use the insulin or there's not enough of it. Some contributing factors for type 2 would be poor diet and obesity. Type 2 can actually be controlled with diet, it can be controlled with exercise, oral medication, and if all of these fail, then they can become insulin dependent as well. So with both types of diabetes, blood glucose monitoring is a must. So this is done throughout the day, and it's done with the blood glucose meter. So some of you may be aware of what these look like. I've seen them before. So the test strip here is inserted into the meter, and the blood sample is applied right to the test strip here. And that is done by just pricking your fingertip here, and this is done with the lancet. So the reading comes up in just a few seconds, and a normal range of blood sugars would be 80 to 120. So with the diagnosis of diabetes comes lifestyle changes for the person. Every meal has to be portioned, has to be measured, all carbohydrates have to be accounted for so that insulin can be delivered depending on how much they're going to be eating. And this can be done through an insulin pump or through a syringe. With my son's diagnosis, I personally took this as an opportunity to begin eating healthy as a family. I did a lot of reading about nutrition, reading the nutrition labels, trying to do as much organic as possible, and also trying to avoid a lot of processed foods. I also tried to include a lot of complex carbohydrates, which include fiber, protein, and I try to do a lot of fresh veggies and fruits as well. So these would be considered lower on the glycemic index, so would raise the blood sugars more steadily and slowly rather than to spike them. So on the opposite end of that, there is simple sugars, which would be candy, juice, soda, any rapid-acting carb like that, and those would actually cause a spike in blood sugars. So this far, you might not be thinking type 1 diabetes, not that big of a deal, some diet changes, some finger sticks, but I do, as a type 1, I want to make you all aware of some of the signs to watch for and some of the complications that can follow. So having previous knowledge of type 1 diabetes myself, having a sibling with type 1, and also I had a grandparent, is what actually saved my son's life. He was just 3 years old when he was diagnosed in 2008. I wouldn't have expected him to develop the disease. He was breastfed for 23 months and was otherwise a normal, healthy 3-year-old. Some of the initial symptoms he exhibited were increased thirst, increased urination. He was craving really starchy carbohydrates and also had become pretty irritable. So according to the University of Maryland Medical Center, some of the signs to watch for type 1 diabetes is the increased thirst, increased urination, sweet-smelling breath, Also nausea, vision changes, weight loss, the irritability, the labored breathing, and also fatigue. So left untreated, type 1 diabetes can actually lead to ketoacidosis. So initial testing is important. This can actually proceed into coma and death if not. So testing can be done with a urine sample at your doctor's office with a finger stick, with a meter similar to what I showed you guys, or also venipuncture. So what is ketoacidosis? Ketoacidosis actually occurs when the body begins breaking down its own tissue and fat for energy, since it's not able to convert the carbohydrates that are ingested for energy. So this causes an acid buildup in the bloodstream of ketones, and this is excreted through the urine. So once a diagnosis, a lifelong of treatment begins. Management includes several different aspects, including the monitoring of the blood sugars. So that's done with the blood glucose meter, and that's done around the clock for most individuals, especially for children, to ensure safe blood glucose levels. As for diabetes, that never sleeps. So management also includes the delivery of insulin through the pump or the syringe. So with the pump, here is just a photo of the pump if you can see that. It is actually connected to tubing, which has a little needle here to this attachment, and that is attached usually to the abdomen. So the insulin is held in a cartridge here, delivered through the tube and through the needle to the abdomen, and thus absorbed into the bloodstream. So a lot of times the insulin settings are preset by the doctors and can be delivered manually or is released at specific times that is set inside the pump. So insulin injected is also, with the syringe, is also monitored by the doctor, and they will set the levels, based on the blood sugar readings and also how many carbohydrates are going to be ingested. So there are, however, side effects to the insulin, and there are complications to not having enough of the insulin. So a side effect of the insulin is actually hypoglycemia. So this can have sudden onset and actually occurs when there's a low blood sugar. So low blood sugar reading usually being less than 70. So this can occur from too much insulin or too much physical activity. So when a diabetic is being active, it's important to do extra monitoring and supply extra carbohydrates if needed when being physically active. So some of the symptoms of hypoglycemia include sweating, shaking, confusion, weakness, loss of consciousness, coma, and death if left untreated. So this has to be treated immediately with a fast-acting carb, and that can be done with juice, candy, or also with glucose gel like this. If the person's unable to swallow, this can be inserted inside the cheek and massaged there, and it's absorbed that way. If the person is unconscious, it can be done with a glucagon syringe. So this is drawn up and mixed together and inserted into the thigh to raise the blood sugar back up. So hyperglycemia, with some of the symptoms that we already went over, this occurs when the blood sugar is over 120. So some of the symptoms can have a sudden onset as well, but also include long-term complications, such as the ketoacidosis, blindness, nerve damage, heart damage, kidney disease, and can also lead to amputation of limbs. So according to JDRF, which is the Juvenile Diabetes Research Foundation, there are 80 new diagnoses of type 1 diabetes in the U.S. daily between adults and children. So more research is being done to understand the environmental factors that could lead to diabetes, such as the pesticides on our food and also GMOs. More research is also underway to improve the treatment regimens of type 1 diabetes, which is really exciting, and also to create new beta cells in the pancreas. So if new beta cells can be produced in the pancreas may actually be able to start producing its own insulin again. So in the meantime, the best thing that we can do is to be aware of the signs and symptoms, what to watch for, and to monitor the disease closely if a diagnosis is made. So knowing the signs and symptoms can save a life, and it saved my son's life. Thank you.